Hello and welcome to all. This is Ankana, the assigned moderator from IGCP Group. I wholeheartedly welcome all the delegates across the country. We are fortunate enough to get supported by the doctors. Thank you, all the doctors, for taking out time to join us today. Now I'm taking this opportunity to welcome today's master doctor, none other than the eminent speaker, Dr. Suchit Thamboli sir. Sir is PhD in Developmental Pediatrics, FIAP, MBBS, DCH, PGDAP, PGDMLS, Consultant Developmental and Behavioral Pediatrician at Chiranjeev Clinic. He is the founder and director of First Child Development Center in Maharashtra since 1992. National Chairperson IAP Growth, Development and Behavioral Pediatrics Chapter 2014 to 15. Central IAP EB member 2017-2019. Now, with the help of Dr. Thamboli sir and his wonderful insights, we'll be taking a close look on today's topic, which is early intervention and stimulation programs. Without any further delay, sir, I would like to hand over the session. Kindly proceed with your topic. Over to you.
Thank you very much. At the outset, I must thank the organizers for giving this opportunity. And we are going to talk on the developmental stimulation programs as well as how to identify high-risk children. So actually be aware of the best in the world, but practice what is feasible is the most important thing, which I always tell. So what are the common questions which are asked by the mother? Whether my child is normal or abnormal, what I can do for detection, what will be his future, what can I do to increase my child's intelligence, my child is not behaving properly. So is there any way to bring him back to track? So all these questions are there in the mind of the mother when the child graduated from the NICU. So it is very important that all NICU graduates should be picked up at that level only, and then they should be given the assessment as well as stimulation. So, what is high risk babies? Actually, it is very important that we should detect high risk babies for early detection of developmental disorder, learning disorder, scholastic backwardness, mental retardation, behavioral problems. So all these problems which we are going to face in a future life of that child should be detected at earliest as possible, and early intervention should be given. So actually, high risk clinic aims at early prediction of outcome of selection of infant who will benefit from early intervention. So assessment done are anticipatory guidance, growth and nutrition, treatment of illness and immunization, neurodevelopmental assessment, Denver scale, or you can use Trivandrum scale or Bailey scale of infant development average norms. All these are, they require only 10 minutes to 15 minutes for assessment. Even Hamilton method requires only 5 minutes. So neurosensory or hearing and vision testing, then metabolic imaging or EEG testing in few conditions. Stimulation or intervention program should be given. We are going to see that in detail, and if required, referral to different therapists. So high risk infant selection criteria, that is birth weight less than 2 kg, asphyxia, that is did not cry for 15 minutes after birth, hypotonia, that is looseness, limpness, floppiness, or feeding difficulties like not sucking well in first 2 days, respiratory distress in first 2 days, jaundice within first 2 days, or convulsions. So all these are risk factors for developmental delay. Like there are established risk factors like German measles in mother, biological risk factors like low birth weight babies, then environmental risk factors like lack of stimulation. No apparent risk factor also can give rise to developmental delay. So in such condition also we must know that this child is going to require stimulation program and assessment by the developmental test. So what are the principles of development? So what principles of development? Actually, we consider that it is a continuous process from conception to maturity. Sequence is same, that is always cephalocaudal, but the rate of development varies from child to child. One field, child may be greater than other field. So there are 6 areas which are considered in this age group below 6 year. One is gross motor development, the another is fine motor development, then mental development, social development, expressive language, and receptive language. So child may be having one field may be greater than the other field. It is intimately related to maturation of nervous system. Certain primitive reflexes has to be lost before the corresponding voluntary movement is acquired. Sequence of development must be kept in mind, and corrected age should be used for the preterm babies. So child always progresses from head to leg. First, there will be head and eye control, then there will be arm and some head control, then trunk and body control, that is sitting and balance, and then leg control. So it doesn't happen that child suddenly started standing only without sitting. So that doesn't happen. So principle is important that it is always cephalocaudal development. So what we can do with the child development clinic? We can say about rate of development, developmental potential of the child, diagnose moderate or severe mental subnormality, assess muscle tone. This is very important that we should start assessing, all pediatricians must start assessing muscle tone, like we are taking pulse or blood pressure. It is very easy if you go on doing it frequently. So diagnose moderate or severe deafness or visual defect, diagnose neurological defect in infancy, or give genetic counseling. So this we can give to the parents. What we cannot do, we cannot make accurate prediction of his future intelligence and achievement. So he might do something else like Telgi with his good intelligence. So this can happen. So determine the possibility that he will undergo mental retardation in future months. So suppose he get some accident and he may get some mental deterioration. So that can happen. And in slow starter, this is very important sentence. Slow starter, single assessment is not sufficient for diagnosis. So here we must do repeated testing, and slow starter and slow learner is different terminology, and we must differentiate them. And slow starter can pick up like Newton, who started his speech at 4 years of age. And what he will do with his talents already I have told. Then specific ability learning disorder cannot be predicted by developmental assessment in early age group. Like likelihood of catch up is unlikely in severe delay. Normally, prediction of mental superiority is not possible at initial stages. Diagnosing mild cerebral palsy or mild mental subnormality in early weeks is not possible. So, what is early intervention? So, as per guidelines of Individuals with Disability Education Act of United States, early intervention services are designed to meet developmental needs of children from birth to 3 years of age who have a delay in physical, cognitive, communicative, social, emotional, or adaptive development, or have diagnosed condition that has higher probability of resulting in the developmental delay. So, what is primary intervention? Primary prevention is level where you reduce the occurrence of developmental disability through reduction of risk factors such as low birth weight, malnutrition, family awareness. So if these factors are taken care, we can do primary level prevention. It is influenced with their efforts, means actually child development can occur with the proper training of the parents. Secondary prevention level goal is to reduce the extent of manifested childhood disability and shorten its duration. So infant stimulation and remediation program operate at this level. So it is very important that we should know what are the Indian infant stimulation program and remediation program. Then tertiary prevention aim is to prevent or reduce complications of disability that lead to a need of institutionalization. So that is again important. So what are the principles of early intervention? Main focus is providing structured opportunities to develop and practice skill appropriate to child development level. Intervention is aimed at encouraging child's general development and not one area only. So we have to consider all these 6 areas which I have mentioned. So parents provide early intervention program at their home, taught, supported by the multidisciplinary professional based on culturally acceptable and safety based approach. And recent survey has found length of session to be 1 hour to 2 hour and 30 minute in or 30 minute in as well as 3 to 5 days. So the program should be given daily, minimum 5 days, and at least 30 minutes or 1 to 2 hours. So, what is rationale behind this stimulation program? Is plastic theory of brain. So, organization of interconnected neurons, which make up neuronal system, is not structurally or functionally rigid as once believed. So rather, individual neurons are able to modify their intrinsic membrane properties and strength of their synaptic connections in response to varying levels of stimulation. So this is very important because role of critical period is 0 to 3 years, and we should catch them as early as possible. So that is important. So then early intervention program for premature infant have positive influence on cognitive outcome in short to medium term. So positive effect of mother-centered early intervention program is important. So mother is considered as a therapist of the child, which is very, very important. So actually here we should know that trying to make your child walk before he is ready is like telling him jump now. So then what you need to do is to help him cross the gap step by step. And early stimulation is providing the right stimulation at the right time, and is the key for the development. So what are the aims of early intervention? Stimulation of child through neurodevelopmental channel, prevention of developmental delay, prevention of asymmetries and abnormalities, detection of transient abnormalities. Suppose in a few patients we can get hypertonia in early age group. But as age progresses, that hypertonia may wane off. So do not label the child at 3 months as cerebral palsy. Just wait for few months, and then if the abnormality goes off, then do not label them. So transient abnormalities are there. Minimization of persistent abnormality is important. Development depends upon the biological inheritance and environmental stimulation or learning. So stimulation programs plays very important role in child development, and mother is best therapist for the child. Age appropriate toys is very important. So at what age, what toys to be given is important. Optimum environment for stimulation is important, and best time for stimulation is when child is most active and playful. So that is again very important. So that time should be taken care of. So mother is the key stimulator. Child development and home environment. Here we must know that age appropriate toys enhances optimal child development. Social skills are developed when more time is spent with the child. And try to recognize and respond to the different signals of the child. So child's early environment is constituted by the mother, father, sibling, and grandparents. So all they should be involved in a home environment. And there are different types of home environment, like cognitive home environment, physical home environment, social home environment, supportive home environment. So supportive is the best one. Then what are the preventive strategies? Maternal nutrition and anemia can be prevented with the iron, folic acid, iodine, zinc. Infection prevention by rubella vaccine. Medical illness, gynecological issues can be prevented by the gynecologist opinion. Antenatal steroid can be given to prevent prematurity. Then better obstetric care is important, better neonatal care is important. So it is very important to actually try to prevent this developmental delay. So what are the intervention which are used? Medical intervention like primary care immunization, morbidity monitoring, drugs, environmental stimulation like nutritional or social. In nutrition, we used to actually measure the anthropometric measurement, dietetic intervention, then social parental counseling, home visit, developmental assessment like DQ, and specific therapy like occupational therapy, physiotherapy or speech therapy, and stimulation program. Then vision and hearing assessment, which is again very, very important. So assessment and if required intervention. Then intervention schedule should be like for first 6 months it is monthly, then 6 to 9 months it is 3 monthly, and after 18 months it is 6 monthly. So that should be the schedule of the intervention. And we should assess history, examination, immunization, routine stimulation program, developmental test, neurosensory test, and therapy, which is again very important. So, what are the screening tests? I already told that Trivandrum screening test or Denver screening test or Bailey scale of infant development, Indian norms, average screening test by Dr. Phatak sir, Arun Phatak sir. Then NEST is the nursery evaluation screening test by Dr. M.K. Nayak, Drawman test by Dr. Pramila Phatak, which is again a very important screening test for 4 to 11 years. We can do it in a large scale also. Farmbird test 3 to 8 years, and the tests which are given in Illingworth normal and abnormal child. So these are important. So then, what is the grading of IQ or DQ we do? If it is less than 20, it is a profound mental retardation. So requires total supervision, minimal self-care, language development is minimal. But 20 to 35, severe mental retardation. So simple conversational skill needs supervision throughout life. 36 to 51, moderate MR, where maximal self-care academic skill up to second standard, functions semi-independently in supervised and sheltered workshop setting. That is important. So we should actually give idea to the parents what your child is going to do with this IQ. So mild mental retardation, special class placement, 4 to 6 reading level, able to function independently as adult. Even this mild retardation children, they can do up to 10 standard. Borderline or slow learner, they are vulnerable to learning disorder, but special help in regular class is required. Independent social and vocational adjustment is possible. Then 85 to 110 is average, 110 to 120 is superior, 120 to 140 is intelligent, and more than 140 is genius. So this is Trivandrum development screening test. Then developmental observation card, which is again very important and very simple for even Anganwadi workers also. So social smile at 2 months, hold head steady 4 months, sit alone 8 months, stand alone 12 months, and make sure that baby sees, hear, and listen. So if MK Sinha has this card, can be applied at any level by any illiterate mother also. So that is important. If it is not done at that time, then you should take advice from your pediatrician. So I have done in my PhD also, and the correlation of sitting alone with the Denver scale as well as Bailey scale, the detail scale, has been found very useful. So I think it is very important that this simple developmental observation card can be used by even any illiterate mother. The developmental assessment, we know that it is very simple by the rattle, wool, bell, ring, or all these are simple material which is required. So this these are the slides from my PhD thesis, that DASI as a gold standard, and DOC, that is sitting at 8 months, has high specificity and accuracy with a relatively low sensitivity. Sitting can be used as a boot tool at 10 months. Neck holding, very low specificity, but gross motor development for the Denver scale can be a very good tool. Again, fine motor can be a very good tool. And Hamilton angle, we should know that at what age, what is the normal angle of adductor angle, heel to ear, or popliteal angle, dorsiflexion, and scarf side. So this is has been shown in this slide. What is adductor angle is between the two thighs. What has been shown in uh, above picture. Then heel to ear, it is again very simple test. This popliteal angle has been shown in this, and dorsiflexion angle. So these are very important. And this is scarf sign, whether the child crosses the midline or not, is assessed with the scarf sign. So all these five features, if you see, we can come to know about the tone assessment, whether it is a hypertonia, hypotonia, or normal tone. So that can be definitely told about that. So interventions should start in NICU. It is very important. So unnecessary noises of alarms should be reduced. Individual lighting unit should be dimmed. Recording of mother's voice can be recorded and played near the baby, but not constantly. Promote bonding through the kangaroo method, passive exercises of joints and gentle massage, and stimulation program for 0 to 2 months. So, what type of stimulation you can give? It is very important that at birth, every mother should be told about visual stimulation, auditory stimulation, tactile stimulation, and vestibular kinesthetic stimulation. Here, we should tell them that any mother after delivery, what she should do, she should talk to the child whenever the child is alert, and when she can show the hanging toys, she can play with the rattles, and actually recorded mother's voice or recorded heartbeats can be uh, act as auditory stimulation. And it is very important that they should listen to the music at least 1.5 feet distance from them, and then for 3 hours a day it should be auditory stimulation definitely helps. And we have seen that with all these four stimulation only, we can see the social smile which is going to appear at 2 months can be shown at 21 days. So that is very commonly seen with the stimulation program. So visual stimulation, auditory stimulation, tactile stimulation, and vestibulokinesthetic stimulation should be started at birth in NICU only. So good carrying position has been shown here. Then what are the early intervention stimulation at risk developmental baby? It should be multidisciplinary approach, program of various activities including play, passive exercises. That is very important, and improvement in one functional area. This is very important sentence. Improvement in one functional area helps the child to improve functions in other area. So I have told 6 areas. If child improves in one area, it can be possible that child may improve in other area. So that is very important. That's why stimulation programs are very important. So what are the standardized stimulation program? Portage Education by Educational Department, Dr. Tehil Kohli. She has done Hindi version of the International Portage Association stimulation program. And here the atoms are given from 0 to 6 years, like शिशु प्रोत्साहन, संचलन विकास, भाषिक विकास, सामाजिक विकास, ज्ञानात्मक विकास और स्वावलंबन. सो दो शब्दों का वाक्य बनाना, आपने क्या करना है, 1 2 3 4 5, और सहायक खेल सामग्री. ऐसे हर एरिया में उन्होंने कम से कम 110 या 150 ऐसे एटम्स दिए हुए हैं. And we can start from where the child is doing. So suppose child's gross motor development is 4 months and fine motor development is 3 months. So we can start according to that. So that is very important. So parents can use this program as a checklist and plan stimulation at home also. Then CDC model of early intervention. Actually, I have done it Marathi also due to our area, but it's available in English and it is very good program. Trivandrum Bal Vikas program. I have already told the 6 areas were included in this program, and this is important. So these high-risk babies were given simple objects. They are available with each and every home, like hanging rotating toy or rattle, or playing music for 3 hours a day, eye-to-eye contact, visual tracking, and facilitate grasp and transfer of objects, which is again very important. Then reintervention in hypertonia. So no massaging is important. Reciprocal, repetitive, rhythmic joint relaxation exercises with all major joints like ankle, hip, or wrist. Opening of fingers, carrying astride hips with legs apart, and definite therapy by the neurodevelopmental therapy or NDT by the physiotherapist or occupational therapist. Then early intervention in hypotonia. Again, here joint approximation techniques are given. Screening with congenital hypothyroidism, CPK levels, and definitive therapy by again physiotherapist. Hearing assessment is very important. Then speech therapy again is very important. Hearing assessment should be done before 6 months of age, and there are simple clues for detecting hearing problem, like baby stiffens, blinks, screws up eyes, extends limbs, or cries with the sudden noise. So response of the baby when you clap hands at about 12 inches distance. The child quietens, turns with widening of eyes, or changes breathing pattern when you shake a rattle or bell about 6 inches away from the ear. So by 6 months, the child is sensitive to sound. Turn his head towards the sound. So best age for the formal hearing test is 6 to 9 months. We should do OE test at birth, but Bera should be done at 6 months. Then what are the warning signs for the hearing problem? If there is absence of babbling and cooing at 1 year, no spontaneous vocalization, inability to understand simple commands at 18 months, then it is definitely alarming. So, screening for hearing impairment, whom to be done? Actually, it is mandatory for all NICU children. Then children who have asphyxia, meningitis, ICH, or ventilated child less than 1.5 gram, sorry, 1.5 kilo, intrauterine infection. So when to screen? So it should be before discharge from NICU and mandatory within 3 months of life. Then how to screen? OE and BERA. So then early intervention and speech therapy and hearing aid or cochlear implant can be done. So it is important. Then stimulation technique for hearing impairment. Make face-to-face conversation while talking to child, eye to eye contact, make variety of sounds in environment, encourage movements of experimentation in everyday situation, which creates sounds and sensation. So early intervention for speech and hearing is very important, where eye to eye contact, speak clearly, do repetitions what you say, use simple language, talk to child whenever possible, make the child listen to different sound, promote symbolization, that is pointing and taking name of common object when it comes in front of eyes. Then visual development. So watches the mother's face intensely as she follows moving ball, looks for the and picks up object, actually enjoy whether the child is enjoying picture book or not, alert peripheral vision. So all these are important. So where eye fixation test is again important, windows test, baby's eye wander from one corner to another, white spot in the pupil, if it is there, it is suggestive of congenital cataract. Does child have strong family history of visual problem? Does the baby has squint after 6 months, because squid below 6 months is common? Does the child hold object very close to face while reading or examining something? This is again very important. So ROP screening is very very important for all premature babies. So first follow up at 4 weeks of life, 31 weeks gestation. If it is later, then actually all guidelines of the ROP screening should be followed up. Uh, that is premature babies less than 33 weeks, less than 1.5 kg, and severe cardiorespiratory compromise, or then other whom should we screen for squint and refractory error at 1 year or after that. So then early intervention for vision can be given with the hanging brightly colored object, hang black and white strip clothes across the crib, mother while maintaining eye to eye contact, do singing or talking, keeping face around 8 inches away. Bright colored balls and balloons should be hanged for providing visual stimulation. To promote visual following, use multicolored small bulb series, and which should be hanged on the wall at the foot end of the child. So definitive therapy is very important, and stimulation techniques can be used by providing the child with the sensation of different texture. Make the child walk on barefoot or grass, on gravel, on sand, and on the road. So encourage independent mobility at home. Do not put the baby always in the crib, and encourage the baby to touch and feel different things. So visual stimulation is very important, bold patterns with the strong contrast. And then we should know in our DOC or developmental observation card, we have seen that there are head holding, sitting, and standing. So there are grades in that also. So suppose for the head holding, grade 1 is head erect and steady. Grade 2 is dorsal suspension, lift head along with the body. Grade 3, prone position, elevates on arms, lifting the chest. Then holds head steady while mother moves around, and head balanced at all times. So uh, grade 5 should be there for the head balanced at all times. So if it is not there, then what is intervention to be advised? So carry child in upright position. Child is made to lie on the stomach A roll is placed under chest. Encourage the child to lift and hold his head by showing colorful toy. Then slowly lift the child from lying down position, holding axilla, to sitting position, and then slowly put him back to lying position. So such activity should be done 5 minutes 4 times a day. And if child doesn't lift head, gently stroke downwards over the neck muscle. So it has been given here. When lying face down, press firmly on the muscle on each side of back, neck, or hip. Child lying on the wedge. So develop head control when lying face up. So this is again very important how to stimulate the child and for the head balance. Then for sitting position, sit momentarily, sit with rounded back, sit with straight back. Then while sitting can play with the toys and can come to sitting position. So at 8 months, baby should come to sitting position. All five grades should be covered. So then intervention for sitting, make the baby lie on back, holding at the axilla, make her come to sitting position, hold her in this position, and then make her lie down again. So it should be done 5 minutes for 4 times. Make the child sit across his mother's knee and just tilt the child forward and sideways so that he outstretch the head. Make the mother raise her knees up. Make the child sit, provide support and toy. So slowly reduce the support. So it has been given here therapy for the rolling, therapy for the creeping, then crawling, sitting. So sitting again we have already told about that. Then standing position. There are five grades like stands holding on the furniture. Take few steps with both hands supported. Stand with wide base. Can come to standing by throwing weight on arm and walk properly. So at 12 months, fifth grade should be completed by the child, which is very important. So if it is not there, then we have to give early intervention. So make the child leaning against the wall, make child come to standing position holding a stool, put toys, then help him to balance on inclined surface, help him to walk with the support using both hands and letter with one hand. So here, see, shifting of weight from one leg to another is done, light support at the shoulder. Then we have given some, encourage him to take steps like the table has compartments and toys is put on every compartment. Hold on the rope. This is again a very interesting that we have rope at any house. So if you put hold on the rope, then the transfer of the weight from one leg to another is done properly. So hold close when the child is trying to walk. So early stimulation is very important. Actually, baby develops a sense of holding, bonding when the cuddled and held. Hang brightly colored objects across the crib. Mother's milk is complete baby's feed. So proper covering helps to prevent heat loss in the newborn. And early stimulation like sound producing toys are suitable for this. Maintain eye contact while talking to the child. Place things just out of reach for the baby's hand and stimulate him to reach out and grasp it. So child should be carried astride. Encourage babbling. Child start talking start taking semi-solids. Shake a bell or squeaky toy over his head. Encourage him to turn his head and find where it is. Allow the child to move freely. Then, for the 6 to 8 months, start calling the child by his name. Put the child over a roll. Gently move the roll from back to back and front to back, and making the child lean, alternating on knees and hands. Help the child to develop a sense of identity, like showing mirror. Banging toys such as drums, fans, or pots can be given at this age. Then 8 to 10 months, encourage the child to stand on by holding furniture. Bring the child's buttock on his heels with the upper part of his body erect and show him toy. Then showing picture books, which is again very important at 9 months. And talking to babies promotes language development. Place peekaboo with the child. Balls with different size dolls puppet, push and pull toys, rocking toys, uh, contentment. Actually, all this baby expresses his joy by performing rhythmic action, and when baby expresses his anger, divert his attention and be supportive. Family members should participate in all these stimulation programs. So give picture book or thick cardboard pages. Child should get interest in learning about the parts of the body. Look out at the window. Talk about what the weather is like. So this can be done at 12 to 15 months. Give the baby two or three blocks of different size. Encourage the child to scribble by drawing few lines. So it is very important. Even treatment for drooling is important for the child who has drooling after 8 months. Remember that drooling up to 8 months is normal, but after 8 months, if drooling is there, then you should give treatment like this, which has been shown in the picture. So, what are the intervention programs which are there in India? Trivandrum Bal Vikas program by Dr. M.P.C. Nair from 0 to 6 years. Upanayan, this is from the Chennai, that for mental retardation. Then Samvan Pradarshika, I've already told, that is a portage education by Dr. Tehil Kohli from Chandigarh. Learning Tree, this is from KG to 5th standard in Pune. The Towards Independence series by NIMH and NVM profile, early intervention developmental profile by Dr. Nandini Munkar. So child's mind, like child's body, needs exercise to grow stronger. So what are the take home messages? It is very easy to detect and treat developmental problems. Just spend 5 to 10 minutes. Approach properly. Know the Indian work. Use simple methods and consider mother as the best therapist of the child. So this is actually door of my child development center, which shows that after climbing the steps of intervention, you will definitely get the ray of hope. So thank you very much. If there are any questions, I will definitely like to answer the question. Are there any questions?
Thank you, sir, for your wonderful presentation, sir. We do have some question from our audience if you like to take that up.
Yes, yes, definitely.
Yes, sir. So, sir, the first question is, what are the common challenges doctor face in implementing early invention recommendation?
What are the challenges?
Yes, sir.
Actually, what pediatrician has to know is is very important is to identify the high risk baby. Then the second thing is that when you identify the high risk baby, you should know what are the screening tests. And screening test learning is very simple. It's just 10 to 15 minutes job. And what are the stimulation program. So you should give standardized stimulation program, which are there. I've already told 6 7 stimulation program, but most important is Trivandrum Bal Vikas program and portage education. So if you know all these things, then you can be sure that your high risk baby is definitely going to do normal. So what problems they face is that they have a fear that they may not diagnose it properly, or they will not tell them proper. But this is very simple, and even with the training your receptionist can do, or some staff can advise about the programs.
Thank you, sir. The next question from our audience is, what role do technology advancement plays in enhancing early invention and stimulation program?
Yeah, this is very nice question, because nowadays we are using early intervention program. There are a few other techniques like robotics, or we are using in this thing cerebral palsy children. Then we are using a few other techniques like AI. We are going to use. We are actually in a phase where we are using AI in few patients, but after the proper the research paper, we will definitely come to tell you that how AI is helping out, or how robotics are helping out. Robotics, there are few papers which has been come up, and nowadays actually all these what is important is that the human touch, which is again, I will repeat that even in spite of all these technological advances, if you do not give human touch, the child is not going to do well. So human touch is again important with all these advances, because these advances definitely will help us, but not great as human touch.
So, one of our audience asked, okay, so yes, my son is 23-year-old young
Mm.
boy, recently diagnosed with rheumatoid arthritis.
Rheumatoid arthritis.
Yes, sir.
Huh. So
So, sir, he is asking, okay, in this arthritis, I'm taking hydrocolloxin and yeah, hydrocolloxin on regular basis.
hmm.
I'm scared to develop cancer because these medicines are immune suppressant.
Yeah, but this is not today's topic, but just to tell them that if they take treatment from rheumatologists, because they know how to use them, how to taper them, and when to use them. So if it is properly used, you should not have that fear that you will get the cancer or like that. But you should actually take advice from the proper rheumatologist.
Thank you, sir. The next question is, how can physician tailor early invention strategies to meet the unique need of each child?
Yeah. It is very important that every child is different. That's why I've told the 6 areas. And in that 6 areas, where the child stands is very important. Actually, when I was doing my PhD, my topic was following of Iris newborn. And what we did, we assessed more than 500 children. And what we did that we picked them up at NSU level. We started stimulation and intervention at NICU level. We trained mother as a therapist of the child. We followed them every monthly, and we did developmental testing every 3 monthly. And at 1 year, we found that abnormality which is going to happen is reduced by 40%, and which is very significant figure. So it is very important that we should start it at as early as possible, and give age appropriate toys, give the proper stimulations, and you should know scientific stimulation. That is very important. And these scientific stimulations are standardized by the proper persons and proper technologies. So it is very important that you should assess them properly, you should label them properly, because it is very important but actually many times what happened that pediatricians or general practitioners, they did one comment in many patients, उम्र के साथ उसका दिमाग बढ़ेगा. This is very very bad statement. Actually, doctor should not comment like this. If as age progresses, he will be normal. This is not going to happen. So that's why we should have assessment regularly, and every 3 monthly for first actually 1 year, then every 6 monthly after that. So if you do that properly, scientifically, give stimulation properly, I don't think that you should worry about the child, because child's potential is always better if we explore it.
Thank you, sir. There is one last question from our audience. What recent research findings support the efficiency of early invention program in various medical conditions?
What? Can you repeat the question?
Sure, sir. So the question is, what recent research findings
Mhm.
support the efficiency of early invention program in various medical conditions?
Yeah. Actually, here I have already told about 40% abnormalities reduced, and that has been proved scientifically. So it is for the high risk babies as well as for the developmental delay. But there are various studies that, like, for what they are expecting me to tell about is, there can be different for the cerebral palsy, there can be different for the Down syndrome, there can be different for the other documentation what are there. So there are definitive studies which says that early intervention is better than any other treatment, and that's why now Indian Academy of Pediatrics has started ECD clinics, which they have trained more than 2000 pediatrician, and actually not 2000 workshops they have done. So maybe more than 20,000 pediatrician has been trained in early child development center to start. They can start ECD clinic, and ECD clinic was our president action plan for last 3 years, and it is a very good program which definitely helps the other pediatrician, and that has actually trained them how to identify and what is to be done. So I think it is very important. Even UNICEF has helped, WHO has helped, central government has accepted that we can, with the ECD or early child development programs, we can actually now it affects the GDP also. So that is very important. That if you give good results to the child with the mental age, then it is definitely we are going to increase our population who is going to be productive. So that is important. That's why GDP also gets affected with the early intervention, and it is very long term investment which should be started at birth, and that is important. That's why early intervention and stimulation plays very important role in the child, and there are many lot of actually I have mentioned in my slides also about some few research papers also. So there are many papers who suggest that early intervention is the best method for the high risk babies.
Thank you so much, sir, for answering all our questions, sir. So, before concluding today's session, sir, any last remark from you?
So last remark, whatever I was actually referring is very important, is that all pediatrician should actually they understand what is high risk baby. So that is very important. So what are the criteria? I've already told that less than 2 kg and premature babies and everything. And then they should identify them at birth at NICU level. They should start giving treatment for mental development at NICU level only, at birth only, and give proper stimulation program, proper toys according to the age appropriate level, and how to apply that toys, how to apply the interventions in the form of exercise, diet, everything they should know. And that's why they can actually advise the to reach them at maximum potential of their child. An individual child is actually, the child can be different in every area, so we should assess them in each area and give them stimulation to actually reach their maximum potential. And it is very important that we must help them to reach them at maximum potential, and it is very possible if we do it scientifically. Thank you very much.
Thank you so much, sir, once again for joining us today. And with your permission, sir, I would like to conclude today's session. Thank you.
Thank you very much.